It's 4 p.m. on South 4. It seems pretty busy, but it's also a busy time of day, and things seem to be carrying on like normal. Nurse Heidi just finished getting report and notices the cardiac alarms ringing along with a bed alarm and an IV pole as well. Not knowing where to start, Nurse Heidi silences the cardiac alarm and runs to see where the bed alarm is coming from. As Nurse Heidi finds the patient half out of bed, not knowing whose patient this is or if the patient is alert and oriented, she decides to bring the patient safely to the floor and then has to leave the room to find the nurse. Back at the nurse's station, Nurse Kathy approaches the nursing assistant Jen after realizing that her patient, who was supposed to have a procedure this afternoon, was given a snack by Jen. Noticing all this chaos on the floor, charge nurse Megan does not know where to start. She decides to call the nurse manager, Sue, and ask her for advice. Sue reminds Megan of using the huddles that were introduced in the TeamSTEPPS training. Megan had a hard time remembering the details and reasons why these are beneficial. Sue tells Megan to care for the patient that fell first, then help Kathy contact the doctor about her patient having a snack. Sue then asked Megan to meet with her tomorrow before her shift starts to review the huddle education. The next day, Sue gathers her TeamSTEPPS education that she received and prepares for the review with Megan. "Hi Megan, how was the rest of the afternoon?" says Sue. "It was okay. We stuck together, but I hope this huddle review will make our lives a lot easier," Megan responded. "Well, let's start our review. Let's start with the TeamSTEPPS icon. In the middle are the 4 teachable, learnable skills that are the core of the TeamSTEPPS framework. These are leadership, situation monitoring, mutual support, and communication. The 3 tips of the triangle are the outcomes of the TeamSTEPPS training: performance, knowledge, and attitudes. The interaction of the 2 requires a team that strives for delivery of safe and effective quality care. Encircling these 4 skills is the patient care team. Now don't forget, TeamSTEPPS emphasizes that this team includes the ancillary healthcare team involving respiratory, environmental services, nutrition, as well as the patient and their family. Let's focus on the huddle, which falls under a team event for TeamSTEPPS and is used to plan safe and effective care. Huddles use situation awareness, which is the ability to know what's going on around you. For us working on a patient care unit, this involves some knowledge of the patients and the staff around you. There are some specific details of a huddle that we will review next. The type of huddle we use can be performed by the team before a shift, which is a more planned event. An unplanned event involves a sudden change in either a patient's condition or staffing that requires a huddle to reestablish situation awareness for the team. Let's quick review what should be covered in a planned event huddle. So at 7:30 a.m., everyone is done with report. The charge nurse calls each nurse and nursing assistant together for about a 3-minute chat. The charge nurse first reviews the hospital's census if necessary, and any news such as policy changes or new devices that have been used on the unit. Then each RN will go over which patients are fall risks, their level of assistance in ambulation, as well as diet changes or blood sugar checks for the nursing assistant. Other information covered would be how many discharges each assignment has in case help may be needed. And another important issue is the patients that may become unstable and what to keep an eye or an ear out for while walking down the hallway. This is the situation awareness we talked about. It is even beneficial to quick ask how each member of the team is today, in case somebody may be preoccupied with something like a sick child or parent or even stress in life from school. Then an RN requests a huddle with the charge nurse and the nurse is working in her hallway because there is a sudden change in a patient's status. For example, a patient went into a rapid atrial fibrillation and the RN is starting a cardiac drip to keep the heart rate between 80 and 110. So, if you hear the monitor alarming, please check it and call if anything is above 140 or below 70 in regards to the heart rate. This type of huddle would take less than 3 minutes and ensures patient safety through situation awareness. This would be an example of an unplanned huddle, still the same goal, but shorter and does not necessarily need to involve the entire team. Speaking of the team, any member can request a huddle and it is best initiated by the charge nurse. In the shift-to-shift planned huddles, either the entire team or the staff working in each hall should meet together. At first, this might be tough gathering all the staff, but with encouragement and experiencing the benefits of huddling, this should decrease in time. You might be wondering where these huddles should take place. The best spot may seem like the nurse's station. However, this can be somewhat of a distance, making it difficult to huddle with the whole team. So, huddles could also take place in the hallways, preferably by the smaller nurses' stations. And of course, patient confidentiality is of utmost importance, so patient names are never to be used. Room numbers will take their place. Something else to keep in mind is the volume of your huddle. Noise is always a tough obstacle in the hospital environment, but we must make all attempts to maintain a low volume and keep the comfortable environment that helps our patients stay safe and comfortable. This may seem like a lot of work, and for what cause, you may ask. Let's now look at the benefits that have been found with the use of TeamSTEPPS techniques in the hospital. Huddling allows for information sharing, and in a culture of safety, this leads to mutual respect amongst the team, which of course creates a stronger team. Situation awareness also encourages improved communication amongst this strong team. Noise reduction can also be seen from using huddles. If you think about the situation awareness and mutual respect from having more information about each other's patients, staff will hopefully be more likely to help with each other's alarms, including IV pumps, cardiac monitor alarms, and bed alarms. Huddles can also support a reduction in patient harm, since the staff working around you will be more informed of your patients and support their stability. This also supports a reduction in errors from both situation awareness and mutual respect gained from using TeamSTEPPS initiatives like the huddle. And of course, the most important piece of using TeamSTEPPS is patient satisfaction and patient safety. Ring, 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 ring. Hi, this is Megan. Megan, it's Annie. I'm in room 5, and I'm thinking this patient might be going through DTs. I'm concerned for his safety. Megan responds, how about I gather the team? We can huddle, reestablish our situation awareness, and alert the team to this change in your patient. I'll call the team. How about in the meantime you contact the physician to alert of the change? Annie responds, sounds great. Megan turns to the manager Sue and says, thank you for all your help. It seems like I'm already Okay, team, I've gathered us together to review a change in one of Annie's patients. Annie, tell us more. Yes, Annie says, it seems he may be going through DTs. I have turned on the bed alarm and given him medication. Megan responds, okay, team, please keep your eye on this room as you're walking by, and also an ear out for the bed alarm, since if he decides to get out of bed, we would need to add more medication or possibly Annie comes up to Megan and thanks her for the great huddle and reports that the team was able to keep this patient safe. Annie then adds that these huddles will be a great addition to our team. So now that we have reviewed the ingredients to using a huddle, we are going to ask each shift team to design a digital story of an example huddle. It can be an unplanned or a planned event. Our goal is to create a collection of huddle examples on our iDrive for the hospital and use it for future reference and also for new employees. The requirements of this digital story include a story that presents the need for a huddle, include the steps required to initiate this huddle, present the necessary people, and demonstrate the huddle itself, and then present the outcome. There are no requirements for length. However, this story should be video recorded. Please see Mary Beth or Jill for assistance in gathering equipment or recording your video. Thank you for your time, and always contact Jill and Mary Beth for more information.